genetic alterations like IDH status, H3 status, then there are oncogenic associations like MAP kinase alterations, and then based on their histological and histogenetic similarities, even if their molecular features are not similar, like tumors which are grouped under other gliomas, glioneuronal tumors, and other neuronal tumors, and the molecular diagnosis based on which we have further subtyped and grouped brain tumors like medulloblastomas. Then the second most important change which has been seen in this classification is the tumor nomenclature. In the previous classification, we could see that certain modifiers were used with brain tumors, and the use of such modifiers was very inhomogeneous. Like based on the site, some tumors were given modifiers like chordoid glioma of the third ventricle because it is seen in third ventricle. But such modifiers were not used in other tumors which are also site-specific like medulloblastoma. Similarly, when we used to report glioblastoma, we used to write glioblastoma WHO grade 4 IDH wild type. But no such modifier was used with ATRT, and as we all know that ATRT is a diagnosis of molecular diagnosis only. Unless we see a mutation in the chromosome number 22 or BRG1 gene, we cannot classify a tumor as ATRT. Till then it should be called as neuronal tumor with multi-layered cross-setting with rhabdoid features. So such kind of usage of modifiers was very inhomogeneous, but now in the current classification they have said that only modifiers with the most important clinical utility will be used, like extraventricular neurocytoma versus central neurocytoma, etc. Second important thing is there were certain names which were used in the previous classifications where the names were showing some aspects of the morphology also. For example, if we talk about myxopapillary ependymomas, even in certain cases the myxoid change or the papillary change is not very much evident, or pleomorphic xanthoastrocytoma. In most of the tumors we are not able to see even the xanthomatous change also. But such terminology is still used because these features are the characteristics of the tumor, even if they are not universal. Similarly, we don't see any medulloblast in the medulloblastoma. But the term medulloblastoma is deeply ingrained in the tumor terminology, that usage of that is still continuing. The next important change is the